Hi guys, this is Mrs. Hall again with your unit on doing the removal of an indwelling catheter. As with any procedure, you are expected to introduce yourself, identify your patient, explain, educate, and get consent for your procedure, gather your equipment, ensure that you have carbolized your tray, and that there is a trash receptacle you can use. Ensure that you have everything you would need for every possible situation related to the procedure. Remember to cover your trolley as you traverse through the ward on the way to the patient. This maintains privacy and also keeps the content of your tray from unnecessary exposure to the environment. Hand hygiene is a must, which is included in another video linked in the card above, as well as in the description section below. Ensure that you provide privacy for every procedure, and ensure that the patient position is appropriate for the procedure that you are about to perform. In this case, I will need access to the genitals and the thigh. I want to have my patient lying in a supine position if it is not contraindicated. Having access to the genitals is crucial since Fowler's position can cause kinking of the tubing from sitting on it. The supine position also gives ready access to the tape that secures the tubing to the thigh. As with catheterization, males are usually supine and females are dorsal recumbent with the hips abducted. This requires clean and sterile donning throughout the procedure. I will not address this since it's included in another video link in the card above, as well as in the description section below. Perform clean donning and empty the drainage bag. Be sure to maintain proper body mechanics. You empty the drainage bag into a urinal since it makes it easier to measure the urine as well as prevents potential spillage as the catheter is removed. In assessing the urine, you want to note the color, clarity, and odor. The color can be clear, pale yellow, straw yellow, amber, deep amber, or concentrated. The clarity can be described as blood-stained or having frank blood, or even cloudy. The odor can be odorless, having a strong odor, or pungent, smelling like strong ammonia. Organize your equipment for perineal care. Everything needs to be in place so that they can be accessible when the need arises. Apply a waterproof pad under the patient to protect the linens. Open your sterile tray and your sterile equipment and perform sterile donning. Prepare your swabs and place a kidney dish to receive the removed catheter. Use your non-dominant hand to retract the foreskin of the male genitalia or separate the labia of the female genitalia. Remember, the skin gets slippery with antiseptic solution, so be sure to have a firm but gentle grip on the skin. Assess the meatus. Note if there is any swelling, redness, discharge, or odor. Clean the meatus using single strokes, moving from the urethral opening outward to other tissues in male, and the entire female pudenda from the clitoral hood to the perineum. Dry the area and then deflate the balloon. Encourage the patient to exhale as you remove the catheter to aid with comfort. Assess the meatal opening once more to establish that you did not miss any abnormality in the first instance. Then make the patient comfortable by removing the drape and replacing their clothing. Pack up your soiled material, cover the dressing tray, then doff your glove and replace the bed rails if necessary and adjust the bed height accordingly. Discuss possible side effects of post-catheterization with patients. This is a part of your education to the patient and it can be done before the procedure as well. These side effects include retention, dysuria, frequency, hematuria, or incontinence. Advise that although these things are common occurrences after catheter removal, they may not require intervention, but they should be reported to ensure adequate care can be provided. You can then open the curtains and wheel your trolley to the slush room, where you can care for your equipment. I look forward to seeing you guys for the next unit. Please pay attention to the videos in the description section below so that you can be aware of all of the lessons for our sessions. Thank you.